So, Professional Regulatory Board of Radiologic Technologists. So, revised code of professional ethics for radiologic technologists and X-ray technologists. So, Article 1, responsibility to the public. So, Section 1, radiologic technologists and X-ray technologists shall acknowledge the supreme authority of the Philippine government and shall adhere to the Philippine Constitution, Republic Act 8981, otherwise known as the PRC Modernization Act of 2000, Republic Act No. 7431 or the Radiologic Act of 1992, other pertinent laws as well as implementing rules and regulations promulgated pursuant to such laws. So, we as a future radiologic technologies or X-ray technologies, dapat natin i-acknowledge ang gihatag na rules and regulations sa Philippine government kay nana sa tong law, which is the Republic Act of Act number 8991. So, we should follow what was written in those laws as a radiologic technologist or a X-ray technologist. So, Section 2, they shall promote public interest and welfare of all time. So, always nato i-remember na ang main priority dito nato, ang main purpose nato kay ang public interest o ang public welfare. So, sila ang nasa top nato na concern, sila ang top priority list, ang public. So, they shall observe, Section 3, they shall observe the highest standards of competence and ethics in the practice of the profession. So, the way, as a radiologic technologist, if nag-work na ta sa isa ka hospital or clinic, always have to remember na we should always do our job with the highest standard, the highest quality, and also we must apply the morals and right ethics that we have learned in school or even in internship time or outside of the academic premises. So always practice the profession with the highest standard. So, Section 4, they shall be involved in civic affairs by participating in activities of relevant organizations to enhance their well-being and that of their community. So, dere, mas nice na, even though after na ito nag-graduate, nakapasa sa board exam, mas nice na continuous atong learning. And by that, dapat mag-participate sa mga activities na gina-organize sa mga organizations na related sa atong professions. So, Section 5, they shall commit to serve their fellow men with justice, good faith, and respect for human rights. So, the way we are serving our patients, even our colleagues, higher bosses, dapat with equal justice, good equality, ug equity, ug also good faith, and also always have to remember na dapat natay respect sa human rights, human privacy, human rights, equal justice. Kailangan na siya tandaan every time na i-practice na to atong profession. So, Article 2, responsibility to the patient. So, Section 1, radiologic technologists and X-ray technologists that provide patient care in accordance with accepted professional and ethical standards. So, dili ta magtaka-taka lang di lang ta magtakatag di lang ta mag-ato-ato alang good na serve sa atong patients. Kailangan nato i-follow tong mga professional og ethical standards na kailangan nato i-follow towards sa atong patient sa paghana sa ilaha like para sa patient care management. Kailangan nato mag-follow right professional and ethical standards. So, Section 2, they shall respect the dignity, privacy, and right to self-determination of the patient. So, even though we are working with the patient, kailangan natin i-remember na kailangan natin respect ilang privacy, ilang self-decision, o kung sa ilang gusto, if na ba sila request, kailangan natin tumanon. As long as naagap man siya sa right ethical standards within our work field. So, Section 3, they shall provide patient care without discrimination by reason of age, race, creed, sex, socioeconomic status, religious or political belief, or nature of disease and illness. So, as a radiologic technologist, dili nato i-discriminate atong patient regarding sa mga factors like age. Di na halimbawa, di ta maghatag og favor sa mga ka-age level na to, or compare sa mga adult or much younger. Dili po ta mag-discriminate sa race, black, white, Asian, different kind of race. As long as they came in with respect, we should also give respect to our patient. Creed, sex, patient na part sa LGBT community, patient male, female, kailangan natin sila taga-anog respect na nararapat para sa ilaha. So, socioeconomic status, pobre dato, wala na hilabot rin as long as we give respects to our patient. Dapat mo nga itong buhaton. And, so, religious or political belief or nature of disease and illnesses. Although, timely karon ang political belief kay naata sa padulungan na ita sa tawag na lapit na itong election, national election, presidency, magbotag president. Although if ikaw ilang political view is different from yours, they came in as a patient, so we serve them, give them the right patient care because they came in as a patient, not a supporter of those political aspirants. So, next is Section 4. They shall possess such degree of technical knowledge and skills reflective of their competence in the field. So, natunan nato sa school, seminars, outside schools, internships sa mga hospital or clinic, kailangan nato i-apply sa atong profession. Although, mayroon nato na over the years, pwede nato ma-apply, pwede nato ma-apply tong habitual good training. Pero, since this is a profession na ay license, kailangan nato gamiton ang highest degree of technical knowledge and skills na naata. Okay, push na to tong self para ma-achieve tong highest degree of technical knowledge and skills. Section 5, they shall advocate the best interest and safety of the patient as well as of the entire healthcare team by ensuring that the radiation exposure is kept at a minimal. So, since we are dealing with radiation, ionizing and ionizing radiation to be exact. Also, there are also non-ionizing, but usually, like X-rays, fluoro, CT, those uses ionizing radiation. And we all know that ionizing radiation is really detrimental to the patient's body. If ang factors na nagamit ito is high, ibig sabihin, pwede higher sa exposure dose na ma-receive sa patient, which is if nagtaas na siya sa limit max na minimum limit, nagtaas siya sa minimum limit, delikado to siya sa patient mismo. So, kailangan to always, every time expose, kailangan na to i-ensure na safe ang patient o ang technical factors na gigamit kay tama o maghatagtag mga gonada shields para ma-prevent ito itong mga radiosensitive areas itong body na dili sila maapektuhan og radiation from the exposure of our examination. Next is Section 6. They shall uphold the principle of informed consent. So always remember, even though patient, dili kayo siya nasa natural state, normal state, always ask for informed consent. Kinsa pa na bata, tigulang, ka-age nimo, always ask for informed consent. Dapat naka-informed consent para if ever na there are things na will not go what the family of the patient wanted or the patient mismo is kay right na-i-defend imong self kay tungod they also nagperma sa sang informed consent, pero kailangan jud nimo i-notify imong patient us ang mahitabo na examinations. Kailangan nila mabalaan na dapat na sila yung knowledge towards examination na mahitabo sa ilaha. So kailangan itong informed consent. Section 7. They shall hold in confidence all information obtained in the course of their professional practice and shall only disclose such information in accordance with the law and principles of medical ethics. So, since we are dealing with patients, kailangan na to i-respect ilang patient privacy. Information dili na to ihatag sa biskan kanin sa dili na to even ang case dili na to siya iingon sa iban as a chismis lang ana good. So, always na disclose ang information sa isa ka patient. Di ta magpatakag ingon sa, ay, si Ani, na ano siya, na siya sakit na yana. Kay kita, as a radiologic technology, di naman takabalo sa, di naman sa na wala man tayo right para mag-diagnose. So, wala po tayo right mag-chismis sa mga, information sa atong patient. So, always respect their patient privacy. So, Section 8, they shall only provide services for which they are qualified by virtue of their education, training, and experience. So, ingon ako ganina, we are radiologic technologists. Wala tayo power, wala tayo karapatan na mag-diagnose o isa ka patient. So, if ever na nag-expose yung patient, tapos nagatagtag result, nangutan na sila kung unsa ang mali sa x-ray image nila ba sa chest, dito tayo ingon na, ay ma'am, nakay tumor, dito mag-ingon na kasi kay wala tayo right because we are not doctors, we are not the radiologists na makadiagnose og diseases through imaging radiograph. So, kailangan din nato siya button. So, for Article 3, responsibility to colleagues, allied health professionals, and health institution. So, Section 1, radiologic technologists and X-ray technologists shall take diligent care of the radiologic equipments, modalities that are assigned to them, and shall make the use of them appropriately and effectively according to the accepted standards of practice. So, always handle those equipments, machines with care. Kaya diba, mahal kaayo ang mga X-ray machines pa lang, MRI machines, CT scans, those cost millions of pesos. So, kita, since we are the one dealing with those machines every day, kailangan na ito hatagan siya right? Ay, kailangan siya hatag care. Care, always na to i-maintain, always na to tanawon, i-check if na-wrong sa atong machines or what. So, it is important na natay daily na maintenance towards those machines as we are the one who's responsible or nag-operate atong mga machines na that costs millions of pesos. So, Section 2, they shall show respect and support to their colleges and other members of the healthcare team. So, mas nice if ang work field niyo is na may teamwork, like even if you hate this person personally, if work professional, so even outside sa inyong department, like sa nursing department or sa medical technologies department, kailangan na to mag-work with teamwork and respect towards each other para mas ang communication good, ang communication kay mas nice ang flow, o if communication is good, mas mapadali ang sa atong mas mapadali ang mahuman ang isa ka imaging or isa ka imaging procedure. Next is they shall apply Section 3. They shall apply sound judgment in the exercise of their profession and assume the responsibility for their own decision. Section 4, they shall assist the radiologist and referring physician in administration of radiologic procedure for the diagnostic and therapeutic management of patient. So, kita, even though wala tayo power na mag-diagnose, pero napo tayo power na mag-help sa doctors na para makadiagnose sila sa patient. So, kailangan tayo tabangan sa contrast media. Usually, kita man dyan mga radiologic technologies ang kanang kamay sa mga radiologists or other physicians sa operating room, sa examination room, every time na may contrast media na gina-inject. So, we should be always open in helping our physicists, our doctors, medical doctors. So, Section 5, they shall recognize the interpretation and diagnosis of radiologic procedures are beyond the scope of their professional practice. So, naingon ako ganina, wala tayo karapatan mag-diagnose because we are not radiologists. So, Section 6, they shall not directly or indirectly assist, tolerate, aid, or abet any unauthorized practice of the profession. So, ikaw, iba na kay friend na medtech, tapos gusto niya mag-expose, gusto niya mag-expose good mag-expose sa x-ray room, even though isang click lang na dili dapat niya tubuhaton kay dili siya wala siya license to operate those machines. So kato, Section 7, they shall report to the Professional Regulatory Board of Radiologic Technologies or other appropriate authorities any violation of Republic Act number 8981, Republic Act number 7431, their implementing rules and regulation and this code of professional ethics. So, alam mo sa radiology department sa inyong team, napansin ka na imo kaban kay na siya yung malpractice na gibuhat, even though personally close mo, it is ethically right na i-report to siya na malpractice if ever ma-encounter man niya sa inyong department. Section 8, they shall keep their reputation above reproach and shall maintain proper decorum in all their actuations to gain public esteem and respect to their profession. So, Section 9, they shall not debase or demean the reputation, competence, and capability of college to aggrandize themselves. So, we are in one team, di ba? Kung apit ka sa radiologic technology radiologic technology radiology team, always consider everyone as your team, pantay-pantay ka mo, and dili na mo isiraon imong colleges para lang ikaw mabango gud imong self towards sa inyong mga higher ups. So, always respect others. Dili nimo sila i-down para i-up imong self. And, last article 4, responsibility to self. So, Section 1, Radiologic Technologies and X-ray Technologies shall endeavor to undertake activities that will foster their professional development, which shall include pursuing continuing professional education and development to upgrade the standard of their practice as radiologic technologies and X-ray technologies. So, it is important na always it is important na ever after na to graduate, after na to board exam, tapos sa board exam, masay siya po na naagad ay continuous professional education, so sa continuous knowledge. So by this pwede tayo mag-appeal sa mga seminars or activities na gina-organize sa organizations na related sa atong profession. Section 2, they shall take active part in relevant activities organized by professional organizations and societies. So always be active if na ay seminars, since karon pandemic, usually webinars ang usually na gina-organize sa mga organizations. Mas nice na magkapit lang mga webinars para mas atong knowledge ma-broaden o dili na mag-stop sa aning stage or age atong knowledge as a radiologic technologist sa atong profession. Section 3, they shall share acquired knowledge and skills and their latest practices and procedures related to radiologic technologies or X-ray technologies to their colleges and other healthcare professionals. If ikaw may natanan ka ng bago na technique na nga ma-reduce ang exposure daw sa patient, mas nice na i-share niyo sa mga colleagues para sila ma-adapt sa tinawag practice nila para sa man Japon sa patients. Ang patient man Japon na patients na mga public man Japon ang makapulos if dili ka magdinalok sa imong technique na natunan. So, Section 4, they shall not render professional services under the influence of alcohol, drugs, or other similar substances or under any conditions that may compromise the effective delivery of healthcare services to the patient. So, I don't know if may nagsulod intoxicated sa alcohol or sa drugs or any substances. Pero, if ever na may na observe ka na kulig nimo na drunk from the alcohol, mas nice na i-report nimo siya or i-notify nimo siya nga di siya mag-take og examination tungod dili siya ang iyang normal thinking deviated siya from the normal thinking. Iyang mind is deviated from the normal thinking. So bawal ang mga intoxicated sa alcohols or drugs na undergo or mag-take sa examination sa radiology na examination room. So, Section 5, they shall avoid conflict of interest or any action that might discredit the profession. Always remember na kailangan na to diba, na ay debate online towards diba, medtech and radtech. So, dito mag-apil-apil ba nga debate or bardugalan online para i-prove na mas important na sa medtech or sa other professions because those are useless things. Hindi na to engage na to self-lead to. Section 6, they shall be entitled to a just and fair compensation for services rendered. So, fair. So, deserve na to ang fair compensations sa itong services na ginahatag towards our profession. Section 7, they shall not allow their names or certificates of registration to be advertised or used by any person or organization unless with their written consent. So, ikaw, imong license, hindi mo ipagapit imong license sa iban. Diba? License ka. Tapos, gibutan imong license dito sa isa ka laboratory clinic, X-ray clinic. Tapos ang nag-operate ay dito dili sila mga board passers. So imong license if ever nabala siya sa mga authorities, imong license ang dehado base mo wala pa kang license. So do not always involve yourself in those illegal stuffs or things. So that's all. Thank you.